Postmodernism, Social Construction, and Narrative Therapy with Sarah Hall and Heather Hanlon. Postmodernism is a branch of art, architecture, literary criticism, and therapy theory that rejects the concept of ultimate objective principles as it may be expressed in any of these subjects. Postmodernism vehemently rejects the ideas of modernism, and with it the concepts of absolutes or objectivity in regards to perspectives. One of the ways in which it is helpful to look through the postmodern lens to understand narratives is that our collective personal narratives combine to produce the social framework we exist in. Simultaneously, our individual stories are limited by the framework we already believe to be in place, which is known as the dominant narrative. The dominant narrative is held in place through social constructionism. Within these spaces, we use stories and narratives about ourselves and others to define our world, and thus our truth. It is through rejection of modernism and its ally, the medical model, that postmodernist therapy is heralded in a new age that exists outside of the world that believes in a universal truth. Rather, there are multiple truths to examine, both within people and without. This therapeutic approach is based largely on the social constructionism theories espoused by Kenneth L. Gergen, whose response to the famous "I think, therefore I am" comment characterizing Descartes' philosophy was, "I am linked, therefore I am." 5 main theorists comprise the major foundations of postmodernism. Harleen Anderson and Harold Gulishian are responsible for linguistic therapy. Tom Anderson is credited with the use of reflecting teams, and Epson and White take center stage in narrative therapy. Harleen Anderson and Harold Gulishian, both working at the Houston Galveston Institute, borrowed heavily from Kenneth L. Gergen's ideas about transformative dialogue. In their world, the interactions we have with others form our own personal and familial narratives, and these combine with other narratives to form the socio-cultural landscape in which we exist. In Depression and Anxiety by Roberts, Anderson is quoted as saying, "The goal is to facilitate dialogue, and through dialogue create optimal opportunities for newness in meanings, narratives, behaviors, and emotions." Anderson and Gulishian's contributions to the field include a not-knowing position. This clearly reframes the dynamic of therapy from a therapist as a change initiator and expert in the field to one in which the client is the expert in all things to do with their own lives, narratives, and feelings. This holds many similarities to the decentered position that is used by narrative therapists, which will be discussed later, and it serves as the foundation for linguistic therapy. Clients share what they believe to be the most significant narratives in their lives, and the therapist's approach to the clients with curiosity and interest. Tom Anderson, a psychiatrist from Norway, went on to create the concept of a reflecting team, wherein a group of professionals watch the interactions of a family and then allow the family members to watch the professionals discuss and dissect the interactions they viewed. This holds many similarities to the Milan model, but with a postmodernist flair, as families proceed to listen and watch the team of professionals analyze the interactions they have just seen. The team presents a positive spin on the narratives they have seen and offer alternative narratives to the family on an equal footing. This is part of witness practice. Here we integrate posture, vocal tone, and breathing. Bitter describes the narrative approach by Michael White and David Epson as the most used social constructionist approach to therapy today. Their work has been notably influenced by Foucault's position that dominant narratives serve to push alternative narratives down, thus furthering their own dominance within the social construction that we inhabit. This leads us to become enculturated to the dominant paradigms and reject other interpretations of events that exist within our own lives. A major part of postmodern therapy includes taking events that have occurred and finding alternative narratives that describe what happened. By reframing the narrative and adopting a position of not knowing, therapy serves to create a more preferred reality for the client, in which the narratives surrounding the events become less painful and more encouraging to personal growth. First, therapists begin by externalizing the problem, and then once this has been accomplished, they ask questions that assist the client in changing the narrative that surrounds the problem. Epson has described a unique take on furthering the co-construction of a new narrative with his clients through the use of sending letters throughout the week that reinforce the new paradigm and detract from the dominant paradigm. With this, clients are able to normalize their own shifting views of themselves, the world around them, and the events that take place in their lives.